first we have to free up the nail border. So I just slide this down on the nail like this. And then around like that. And then we got this little pus right there, like underneath the nail. And slide it down. So then both sides here, underneath, are free. Now I have this thing called an English anvil. It's kind of cool. One side's flat, the other side cuts. So you come around the side of the nail like that and cut the nail. And then the nail goes further back underneath the skin. So then I take this little blade and I just go on the side of the nail here and push it back up and down. So it cuts the nail plate underneath the skin. I take a hemostat, kind of cool. And I put it in here like this at an angle to get it in the pull and twist. And it comes out with the nail. Like that. Then I take out a small little curette and curette it, make sure there's no more nail spicule in it. Now it's always important, and a lot of people don't do, or take wound cultures. So I always take a culture. I'll be on antibiotics already for a few days with Keflex, so sometimes if you've been on antibiotics you won't grow anything out. But you did have some pus in there when we did that. So you just swab the area. Like that. Push any out. Okay. This takes about 3 or 4 days. And it will tell, if you can grow anything out, it will tell what the bacteria is. And then it gives us a list of antibiotics that will fight against it, which is really nice. This, you just go down the list and you pick the antibiotic that you want. And that's it. And then once this infection heals up, then we can go and put acid in there and clean it. So right in here. See this? To get the skin off. Yeah. Okay. We have some loose skin here from this abscess, and you don't want to leave loose skin. You want to just come and clean it up. So we're going to take this off. Little granuloma here. This is just immune cells, neutrophils, microphils. Yeah, this is all puffy in here. Okay. So I put this in here and I inspect, and you want to, sometimes if there's deep infection, if you have tracking, that will go to the bone. If there wasn't any bone probing, which was good, it was self-contained, superficial abscess, and that's the end of it. So then what I do is I just wash it again with betadine. Betadine is the best antiseptic soap to use. And then I'll just dry it off. We didn't have to use a tourniquet, wasn't much bleeding. And then we use this antibiotic ointment called Bactroban. You just stick it like that on the side. Take the gauze, fold it over. There'll be a little bleeding for about 20 minutes. And I use Coban as a little compression dressing. Wrap around it. You don't want to make this too tight because it can act like a tourniquet. smaller piece, go over the top. You want to keep it clean, and I like wearing socks over this to add an extra layer of protection.